Hello, welcome from ADRA Yemen. My name is Paul Apedha. I'm a health specialist with a nurse midwife training background. I am specialized in working in very complex emergency health situations, such as in the Ebola outbreak in West Africa. Now I'm here in southern Yemen. I've been looking forward to CCIH. With this presentation, it is my sincere hope you will go home with a very practical example. ADRA has a large program funded by USAID Bureau of Humanitarian Assistance that includes essential primary health services in several governorates in southern Yemen. Here, ADRA supports community health volunteers, and we support primary health facility workers such as medical assistants, midwives, nurses, nutrition workers, and the cleaners. I want to share with you how we are being very deliberate in how we work. We want to ensure that anyone living within one of our many health facility catchments, anyone in contact with any ADRA health facility staff or any community health volunteer in their community, hears one voice and experiences as it one set of hands contributing to fully integrated programming. Come with me as we go to Lahaj Governorate to see how ADRA community health volunteers and health facility workers are speaking in one voice. Behind me is the IDP site in Al Hobeil that is covered within the catchment population for the Al Hobeil health unit that we are supporting, limited curative care and minimum service package for health. Quite a number of beneficiaries are received at the same IDP site, but we still have a long way to go since we are still increasing the capacity of the community health volunteers so that they can be able to serve properly the people living here. Our community health volunteers are an integral part of community health that is a building block for primary health care. We are here at Al Hobeil IDP site. Our CHVs usually conduct home visits to conduct health and nutrition activities, with more emphasis on IPC and standard precautions for COVID-19, health, wash, and nutrition messages that they pass across. This comes screen the children, and for those who need referral, they are referred directly to the health unit. Our community health volunteers are trained to deliver health messages on COVID-19 prevention, signs and symptoms, and referral. Also, they are also trained to take family work with integrated social behavior change messages on wash, health, and nutrition. As you are seeing here right now, she's delivering messages of COVID-19 prevention, showing the mothers with the posters and the other illustrations. The community health volunteer is demonstrating how to give the ORS, how to mix it. She is currently seeing a mother with a child who has had 3 episodes of diarrhea. She will be demonstrating how to give the ORS to the baby to stabilize as she refers the child to the health unit. There is a clear line of link of referral between the community and the health unit to the community health volunteer. With colorful, well-explained posters like this, which can be read by anyone, and the pictures are done so that they can be interpreted easily by the community members, our well-trained community health volunteers deliver the messages to the community members, focusing mostly like this one on COVID-19, standard precautions, how to stop the spread, and how to prevent infections. We are also supporting the facilities that are supporting them with minimum service package essential primary healthcare medication. We are also supporting with equipment, basic life support equipment to include furniture at the health facility level. While undertaking our routine supervisory visits to the facility, the mother who shared the first bouts of diarrhea at the IDP site in Al Hobei has just arrived at the facility. The medical assistant has screened the baby and clad the baby according to the IMCI protocols. Temperature has been taken to rule out any fevers as a part of prevention and early detection of COVID-19.
عدد الحالات يوميا للمركز الصحي حوالي 50 مريض.
So how do you think the referrals done by the CHVs from the community to the health facility helping the community?
هو تعامل المتطوعات مع الناس تمام. يعني المتطوعات متواضعات ويعامل الحالات المحالة له المركز الصحي تمام.
I have seen on the health facility wall 6 key messages for social behavior change and COVID-19 prevention messages. Are they the same messages delivered by the community health volunteers at the community level?
يروح المتطوعات للمخيم وللقرى المجاورة يعطوا المواطنين يعني حول الوقاية من الكورونا وكيف المباعدة بين المواطنين وأي حالة مصابة بسعال نحاول يبعدوها من الأشخاص السليمين وعلى الإسهالات.
What kind of activities do you do while in your daily work with ADRA?
أروح الزيارات يعني المنزلية وأخذ المواطن الأطفال من 6 أشهر إلى 57 شهر والأحال الأطفال يعني لهم في سوء تغذية الحاد الوخيم والحاد المتوسط يعني الحالة للمرفق الصحي، أيضا أمهات الحوامل والمرضعات لأقل من 23 يعني سنتي يعني عندهم سوء تغذية حالة المرافق الصحية، بالإضافة إلى التوعية على تغذية الأم الحامل والمرضع وتغذية الأطفال والتوعية يعني على كورونا وعلى الإسهالات والأحالة المرافق الصحية يعني.
So what do you do with cases of diarrheal cases that you see at the community level?
يعني أول نقوم بفحص الطفل من خلال يعني مشاهدة عليه علامات الجفاف ونقدر الأم أنها تعوض الطفل بالسوائل وتستمر بالرضاعة، ثم يعني تحيل يعني الأم لنقل طفلها إلى المرفق الصحي خلال 24 ساعة.
So when you refer to the facilities, how are the patients received when they come to the facility?
يتم استقبال المرضى من خلال العمال الصحيين في المرفق الصحي ويعني اعطائهم العلاجات المناسبه.